Hi guys, this is Jess Fida, and this is my presentation on the Family First Prevention Services Act for Social Policy Analysis. So prior to this course, I had never really thought about some of these policies in like a bigger scale, and I was more focused on the micro level of social work. So it was really interesting to be able to kind of research this policy and identify how much it really connects to my current role and career as I work directly with families who are in active crisis, and I provide like some of these preventative based services. So it was actually a really cool opportunity to be able to research and navigate this policy. So just a little overview of the agenda. I'm going to give you guys a brief explanation of the policy, discuss both the stated and latent goals of the policy, the outcomes of the goals, and the unintended consequences of the policy, identify if it is cost effective and its current economic impact, um, current proposals for policy reform, and some of my ideas about how I think things could change, and how the policy supports human rights. So, what is the Family First Prevention Services Act, or FFPSA? It is a selective social welfare policy, and it serves children who are at risk of being displaced from their homes or being placed in foster care or residential care services. It is funded through Title IVE funds, and they're used for time limited evidence based services that include in home skill based programs for parents and substance use treatment and mental health services. The history of the program kind of shifted and has moved over the years and kind of started with the basis of the Social Security Act. And as time has gone on, this program has kind of evolved from that reactive approach of immediately removing children out of a home to a more preventative based option that focuses on family unity and restructuring. The stated and latent goals of the Family First Prevention Services Act. So the stated goals are that the FFPSA aims to prevent unnecessary foster care placements, reduce reliance on group and congregate care, and restructure funding for family based supports. The unstated or latent goals of the FFPSA are to shift from out of home foster care placements and focus on evidence based, in home, or community based treatment, shifting away from those institutionalized based placements and focus on efforts of kinship navigation, which would be for children to be placed with family members, relatives, in the event that they cannot remain in the home with biological parents, and place a financial cap on necessary congregate care and focus on that idea of reunification as being the end goal and focus on those direct family based services. The outcomes, so it's hard to really say if the policy has necessarily been successful or unsuccessful. In my research, I found there was a lot of mixed thoughts and ideas. The act has made progress in shifting the child welfare system towards more towards preventative evidence-based model instead of that reactive congregate and residential placements. But there is a little bit less evidence in supporting the overall goal of reducing congregate and foster care placements. Um, and in looking in some of the things locally here, and even when I'm working with children in the foster care system, a lot of them are placed with non relatives I've found within the agency I work for, and within my own community. Another goal is to keep children safe through the implementation of funding for family-based preventative services. But on the downside, families in rural or underserviced communities may not necessarily have access to these programs or preventative services. Another outcome is the use of the evidence-based services. And through my research, that's kind of the area that the policy has thrived in, as the Act utilizes the Title IV funding through the Prevention Services Clearinghouse. And that works to evaluate prevention programs according to standards that they have set. And they currently categorize programs as well supported, promising, or not currently meeting criteria. So they do have strong basis for if these programs are actually effective. So some of the unintended consequences of the FFPSA, probably one of the biggest ones is that shift in the funding and spending, um, trying to reduce or eliminate the congregate care services. The shift comes at a cost to states, and this has caused a reduction in other services such as community-based prevention services, workforce support, family interventions, and training, as the burden comes back on the states for paying for the congregate care services that are still in place. Another consequence is that because the FFPSA focuses on family-based placements and moves away from the congregate care services, there has been more of an increase in the need for foster care and specialized placements, and they just simply don't exist, or there's not enough families that are meeting the requirements, or they just may not simply have access in the underserviced and rural communities. Another factor to consider with the program is that while it aims to prevent those foster care placements, it doesn't automatically mean that it's a better outcome if a child remains in the home. So I think that that's also another factor to consider with this. Is the FFPSA cost effective? The economic goal for the policy was to invest in prevention services to keep families unified, as this was believed to be more cost effective than residential based placements. And as I was doing research, I was kind of in the mindset that keeping a child in the home would probably be much more cost effective than any sort of placement out of the home. But as I was doing the research, I found that the actual cost effectiveness of the policy is more difficult to determine, just because there's a higher cost in states and in communities to ensure that they have and are able, and if they're not, they're able to develop prevention infrastructure programs, ensure that there's qualified professionals, that they're meeting those evidence-based requirements, and the modification of any residential programs. It shows, I mean, that there is potential for the policy to be cost effective, but again, it's kind of based on the states and their ability to implement effectively over time. Current proposals for policy reform. So, current policy proposals and implementation for FFPSA focus on expanding funding and flexibility, particularly to those in rural or underserved communities, streamlining kinship caregiver licensing and providing the kinship added and extra support, broadening the approval of criteria for services to be included to support and assist with family preservation. I found some research looking into not only like the mental health, substance use treatment, and the parenting classes, but also working to provide families with housing assistance, domestic violence, employment, things that can also contribute to a child, having to be removed from the home. And then evaluating the outcomes of families within the program. Like I said, I think it is a very strong program and there's a lot of promise, but there's definitely some room for improvement. And how does the FFPSA support human rights? It supports human rights by emphasizing the safety, well being, dignity, and preservation of family relationships for children and families that are involved in the child welfare system. And I think that by prioritizing those family based and kinship placements when children can remain safely with relatives, it supports children's rights to maintain meaningful family relationships, and it promotes children's safety and well being by providing families with services intended to address risk before the result in foster care placement. So that is my presentation on the FFPSA. The next couple slides are just some of the references that I utilized. And thank you again for listening to my presentation. And please feel free to ask questions. And I look forward to receiving feedback from everyone.